Hi everyone, I hope you're doing well. In this week's module, we're focusing on the blood vessels, and so I thought I would use our lab list as our outline for this module because it does cover most of the major topics that we're going to explore in the lecture material in Module 3. So, the first item on the Module 3 lab list here are identifying the tunics of the blood vessels. And the tunics of the blood vessels are the layers that make up the walls of the vessels. And so the term tunic just means a layer or a covering. There's three layers specifically that make up both the arteries and the veins, and those are the tunica intima, the tunica media, and the tunica externa. Now, the tunica intima is the deepest layer, so that is, it is the layer or set of layers that's closest to the blood that's flowing through those vessels. And it contains three structures. The endothelium, which is a lining that helps to make the inner walls of the blood vessels smooth, because if the inner walls of the blood vessels are rough, that has a tendency to make blood flow turbulent, and when blood flow becomes turbulent, blood has a tendency to form clots, and so this smooth lining really helps to reduce spontaneous clot formation within the blood. The next layer within the tunica intima is a connective tissue layer that's called the subendothelial layer. It's mostly made out of areolar connective tissue, and so it really just kind of serves to bind the endothelium to the remaining layers. In arteries, but not veins, we find that there is a third layer within the tunica intima. That's called the internal elastic membrane. And the reason for this is that arteries tend to experience higher blood pressures than veins, and as such, they require a little bit more stretchiness, a little bit more elasticity in their walls. And so this internal elastic membrane helps to give arteries a little bit more stretchiness that we just don't see in veins because we don't have our blood vessels don't have the internal elastic membrane in veins, but the internal elastic membrane is present in arteries. So, the next layer, the middle layer, is called the tunica media, and this contains mostly smooth muscle in both arteries and veins. And in the arteries, it contains another elastic membrane that's called the external elastic membrane. And again, this membrane helps to provide some elasticity and some stretchiness to allow those blood vessels to stretch when they experience higher blood pressures or high blood pressures that we typically see in arteries. We typically don't see very high blood pressures in veins, and so veins have really no need for a stretchy membrane like the internal or external elastic membrane. So for that reason, we only find the internal elastic membrane and the external elastic membrane in the walls of arteries. And finally, in both arteries and veins, we have an external layer that's referred to as the tunica externa, which is mostly composed of collagen fibers. And those collagen fibers are going to serve two purposes. The first is going to be to help reinforce the walls of the blood vessels, so that really kind of, in a way, limits their ability to stretch out, including the arteries. So the arteries do have a lot more elasticity, a lot more stretchiness than the veins do, but the tunica externa in those arteries helps to prevent those arteries from bursting under extremely high pressures or from any kind of damage. So the collagen fibers in both the walls of the arteries and the veins in the tunica externa helps to reinforce the walls of both of those vessels. It also serves another purpose to anchor the arteries and veins to nearby structures, so nearby muscles, bones, other connective tissues, that kind of thing. We also see that in the tunica externa, there are very small arteries and very small veins that are collectively referred to as the vasa vasorum. And the vasa vasorum is a term that literally means the vessels of the vessels. And so these are small arteries and small veins that help to nourish the outer tissue layers of both the arteries and the veins. Because even some of the very large arteries and some of the very large veins, their walls tend to be fairly thick. And for that reason, it makes nutrients diffusing to them much more difficult. And so it helps when there is a small specialized set of blood vessels that is specifically functions to deliver oxygen and nutrients to these outer layers of tissue that we see in the arteries and the veins collectively. So especially the large arteries and the large veins collectively. We also have, kind of moving on, we have different blood vessel types. We've got a couple of different types of arteries and a couple of different types of capillaries and veins that we'll take a look at. Beginning with the arteries, we have three types of arteries that we'll examine. The first are the elastic arteries, which, as their name implies, they contain large amounts of elastic connective tissue in them, specifically in the tunica media, which is where the external elastic membrane is located. And these elastic arteries tend to be very large in diameter. Because they tend to be very close to the heart in terms of proximity. They tend to receive blood flow from the major ventricles of the heart, so that is the right and the left ventricles. And for that reason, they have a very large diameter, which means that they have a very low resistance to blood flow. And so when there is low resistance to blood flow, that's going to make blood flow very easy. And so there's a concept that I talk about in the lecture material called Poiseuille's law. And Poiseuille was a French physiologist who described fluid flow through vessels. And one of the concepts that his law examines is the diameter of blood vessels. And so we see that the larger the diameter of blood vessels, the easier it is for blood to flow through them because there is low resistance to that flow of blood. So anytime we have a low resistance to blood flow, we're going to have really good flow rate. And it kind of makes sense if you think about the word. If you have high resistance to flow, right, you can imagine that flow will be impeded or slowed down. But if you have low resistance to blood flow, that's going to make blood flow that's going to increase blood flow and promote movement of blood through those vessels when the resistance is low. So the elastic arteries not only have large diameters to create lots of blood flow, they also function as pressure reservoirs because the elastic connective tissue that's in their walls helps them to recoil under high pressures, and it helps to essentially provide and assist a little bit of supplement to the pumping action of the ventricles of the heart. So because the elastic arteries have the ability to stretch out, they will recoil after stretching out, and that recoil helps to kind of further push blood away from the heart as arteries do. So we have the muscular arteries as well. The muscular arteries are going to be a little bit further from the heart, not quite as large in diameter as the elastic arteries. As their name implies, the walls of them contain large amounts of smooth muscle, specifically in the tunica media, because that's where we saw high concentrations of smooth muscle in the walls of arteries. And as such, the muscular arteries function to control blood pressure and blood flow through the body. The muscular arteries control blood pressure by controlling diameter. So the muscle that's in their walls will change diameter depending on blood flow needs or blood pressure needs. And as I mentioned a few moments ago regarding Poiseuille's law, that blood vessel diameter plays a huge role in changing the resistance of blood vessels, and in doing so, it also plays a huge role in changing the flow of blood to different parts of the body. So by using the muscular arteries, the body can really kind of control where blood is flowing to, and also how much pressure is that blood experiencing. And finally, we have the smallest diameter arteries, which are referred to as the arterioles, and the arterioles function to deliver blood to capillary beds. And capillary beds are where exchange of oxygen and nutrients occurs between the tissues and the blood. And we're going to see a couple of different types of capillaries here on the remainder of this list here. We have the continuous capillaries, which are a type of capillary that's going to be the most common, and they're also the least permeable capillaries, so that as their walls are not as leaky or as permeable as other types of capillaries are. So there's not going to be there's going to be some fluid leaking out of these, some fluid, some liquids from the blood leaking out of these into nearby tissues, but not as much as in some of the other capillaries that we're going to examine here in a moment. The continuous capillaries are abundant in places like the skin, the muscles, the lungs, as well as the central nervous system, so these have a fairly widespread distribution in the body. The next capillary type are called the fenestrated capillaries, and the term fenestrated just means they have pores in them, and so these pores or these fenestrations help to enhance filtration or absorption, and so for that reason, we find fenestrated capillaries in places in the body where filtration or absorption is really important. And two really important places that we're going to examine in this class where that filtration or absorption occurs is in the kidneys. So we'll see that the kidneys use fenestrated capillaries to separate some of the fluid from the blood, so that way the kidneys can then work to process the blood and cleanse it of any waste, and then return that cleansed fluid eventually back to the bloodstream. But the initial filtration step in the kidneys is accomplished by these fenestrated capillaries. We also see fenestrated capillaries in the walls of the small intestines, because the small intestine is going to be the major site of nutrient and water absorption in the digestive system. Finally, we have a third type of capillary that's called the sinusoid capillary, and the term sinusoid means that the walls of the capillaries have large pores, extremely large pores in them, so they have these large sinuses, if you will, these large cavities, if you will. These are a very rare type of capillary. They're also the most permeable, so as their name implies, because they have these large pores, these large openings in their walls, they tend to have a lot of fluid leak out of them, including some cells, some blood cells and things like that. And because these are a very specialized type of capillary, they only occur primarily in places where a lot of detoxification or immune system function is going to occur. So we see sinusoid capillaries in the liver, because the liver plays a huge role in cleansing the bloodstream of toxins and other things that we may have ingested and been absorbed into the bloodstream through ingestion. And the sinusoid capillaries also occur or are found in a couple of lymphatic system structures like the bone marrow and the spleen. And their purpose there is to help cleanse the blood of dead cells, or help to cleanse the blood of any kind of bacteria or pathogens that may have entered the bloodstream. It makes the sinusoids make it easier for dead cells, and specifically dead or dying red blood cells, to leave the capillaries and enter the spleen, where they will be recycled. Or it makes it really easy for leukocytes to enter the bloodstream and fight infections from the bone, leukocytes from the bone marrow, to get into the sinusoid capillaries and fight infections in the blood from there. So we've got three types of arteries, three types of capillaries, only two types of veins. We've got venules, which are small diameter veins that essentially are taking blood or shuttling blood away from the capillary beds back towards the heart. And then we have the veins themselves, which tend to be very large diameter, but also very low pressure vessels that are returning blood back to the atria of the heart. I've kind of simplified the specific list of arteries and veins that I would like you to identify specifically on the diagrams. There's plenty of practice questions on these in the Lab 3 lab report for identifying specific arteries and veins in the body. We'll begin with the arteries, which, keep in mind, collectively the artery's job is to always take blood away from the heart. So notice that this description or this definition doesn't mention anything about oxygenation status. So it's not always true that arteries carry oxygenated blood, but it is always true that arteries are carrying blood away from the heart towards the body's capillary beds, where those exchanges of nutrients and oxygen and things like that are occurring. Right? So we've got a couple of major arteries that I'll highlight here. First, we have the pulmonary trunk, which the term pulmonary means lungs, and so this is a major artery that is going to take blood from the right ventricle to the pulmonary arteries. So the pulmonary trunk will branch into the right and left pulmonary arteries, and it's the right pulmonary artery that takes blood to the right lung, and the left pulmonary artery that takes blood to the left lung. So the remaining arteries are what we call the systemic arteries, in that they take blood to tissues other than the lungs. Beginning with the ascending aorta, which is the part of the aorta that receives blood from the left ventricle and then directs that to all of the body's major systemic arteries. So that is tissues other than the lungs. So from there we have the aortic arch, which will then branch into several arteries that come off of the aortic arch. And then the aorta will turn downward and descend. So there's a descending part of the aorta, which becomes the thoracic aorta as it moves past the heart and the lungs. The aorta will then also move down to the abdomen, where it becomes the abdominal aorta. And so all of the body's major systemic arteries come from these aorta structures. We've got the coronary arteries, which are the small arteries that specifically direct blood to the myocardium of the heart, which is the musculature, muscle tissue of the heart. Because recall that the blood that's flowing through the heart doesn't actually nourish the myocardium, and so the heart is very dependent on these coronary arteries to direct blood flow to the myocardium, make sure that musculature is getting enough oxygen and nutrients so that it can continue beating. The next artery is the brachiocephalic trunk, which is a major artery that, if you break the name of it down, brachio, that means the arm and the shoulder, and cephalic means head. So this is a major artery that has smaller arteries branch off of it that are going to serve the shoulder and the upper limb, as well as the head. One of those major branches are the common carotid arteries, which are found in the neck. The common carotid arteries are taking blood up to the skull and the brain. The common carotid arteries will branch into the external carotid arteries and the internal carotid arteries. The external carotid arteries, you can kind of use the term external in them as an indicator that the external carotid arteries are taking blood to tissues that are external to the skull. So the muscles and the skin and things like that, the connective tissues of the skull that really are everything except for the brain. Right? The internal carotid arteries, on the other hand, enter the skull, and it's these arteries that are the primary arteries, or some of the primary arteries that are delivering blood to the brain. The vertebral arteries, which are found in the lateral foramen of the cervical vertebrae, are arteries that also take blood to parts of the brain, including the cerebellum as well as the brainstem. So we've got both the internal carotid arteries and the vertebral arteries, which are taking blood to the internal tissues and internal central nervous system structures found within the skull. We also have a circular shaped artery that's called the cerebral arterial circle that's found at the kind of the base of the brain. It's also referred to as the circle of Willis. And this is a circular structure because the circular structure helps to redirect blood flow in the event that a clot blocks or occludes part of that artery. And so what that does is having a circular structure at the base of the brain for the arteries allows blood to continue flowing to the brain, even if part of that cerebral arterial circle is blocked by a clot. So the formation of this circular structure is essentially a safety mechanism to allow blood to essentially be rerouted in the event that there's a clot that threatens to block major blood flow to the brain. We've also got subclavian arteries, which are arteries that pass under the clavicle bones, and they serve tissues and musculature near the clavicles. The axillary arteries, which are found in the axilla region, so the underarm region. The brachial arteries, which are found in the arm. The radial and ulnar arteries, which are found in the forearm, and the digital arteries. And so keep in mind that these arteries are not only named for the locations that they're found in, but also keep in mind that they are named for the tissues and the musculature that they're going to serve. So you can always kind of infer or imply that arteries are delivering blood to nearby tissues from wherever they are found. So for example, the digital arteries of the upper limbs are going to direct blood to the digits or to the fingers. Kind of moving down the list of arteries here, we have the celiac trunk. The celiac trunk is a major artery that directs blood from the abdominal aorta to major digestive system organs like the stomach, the spleen, the liver, the gallbladder, the pancreas, and even parts of the small intestine like the duodenum. We have the gastric arteries, which the term or the name gastric implies the stomach, so that's a major set of arteries that's delivering blood flow to the stomach. Splenic artery, which is, as its name implies, delivering blood to the spleen. The common hepatic artery, which not only delivers blood to the liver, because the term hepatic means liver, but it also directs blood to the gallbladder as well as parts of the stomach as well. So it's kind of supplementing what the gastric arteries are doing as well. The superior and inferior mesenteric arteries are arteries that are mostly serving the intestines. So the superior mesenteric delivers blood to most of the large intestine and pretty much all of the small intestine, with the inferior mesenteric kind of directing blood to some of the distal or some of the later parts of the large intestine. We also have the renal arteries, so keep in mind that the term renal implies kidneys. So these are the major arteries that are delivering blood flow to the kidney. So that way the kidneys can do their job and function in filtering and processing and cleansing the blood that's coming from those arteries. From there, we've got arteries that proceed down into the lower limbs. So the common iliac arteries are essentially kind of a major branch off of the abdominal aorta. The common iliac arteries branch to become either the external iliac arteries or the internal iliac arteries. The external iliac arteries essentially just pass right by the hips, and these are the major arteries that are delivering blood to the arteries that are found in the lower limbs. The internal iliac arteries are smaller arteries that mostly carry blood to the internal parts of the pelvis. So we see that the internal iliac arteries are delivering blood flow to things like the gluteal muscles and some of the reproductive organs and some of the reproductive structures like the ovaries or the testes. We also have the femoral artery, which is in proximity to the femur, so it's the major artery that passes by the bone in the thigh. That becomes the popliteal artery as it passes behind the knee. Then it branches into the anterior and posterior tibial arteries. There's a small artery at the top of the dorsal part of the foot, which is called the dorsalis pedis artery. And that becomes a set of arteries called the arcuate arteries, which branch into the digital arteries of the lower limbs that help to carry blood to the toes. So notice that the digital arteries are referred to as the digital arteries that serve the toes are named in the same way as the digital arteries that serve the fingers. So just kind of be aware of what diagram you're looking at because you'll see digital arteries in the upper limbs that serve the fingers and digital arteries that serve the toes and the lower limbs. So, but they're both named the same. So that does it for our list of arteries. We also have a fairly shorter list of veins here. And recall that veins are blood vessels that are going to be taking blood back to the heart. So veins are going to be receiving blood from capillary beds, and they're going to be returning that blood to the atria of the heart. We've got the pulmonary veins, which these are, recall that the term pulmonary implies the lungs, and so the pulmonary veins are delivering blood back to the lungs, delivering blood back from the lungs to the left atrium of the heart. So these veins are going to be taking blood back to the heart, and then the heart is going to direct the blood into the major arteries from there, because the pulmonary veins are carrying very well carrying blood that's very well saturated with oxygen, and so it's going to be able to deliver those to the body's systemic arteries to take that oxygen to the tissues and things that where it's needed. Looking at the major veins in the head and the neck, we have the external jugular veins, which are the major veins that are draining blood from the tissues external to the skull, so the muscles, the skin, and things like that. And then we have the internal jugular veins, which are the major veins that are draining blood from the brain and the other tissues that are internal to the skull. We also have the vertebral veins, the brachiocephalic veins, which are major veins that are found in the shoulder region and shoulder and neck region, I should say, that are receiving blood from the brachial region, that is the upper limb, as well as the cephalic or head region. So the term brachiocephalic implies that blood from draining from both the head and the upper limbs is going to be received by these veins. The brachiocephalic veins will eventually drain into the superior vena cava, which is the major vein that is returning blood to the right atrium of the heart. So the superior vena cava is really serving all structures that are superior to the heart. So that includes blood being drained from the head, the neck, and the upper limbs. Is going to be returned to the heart through the superior vena cava. We've also got in the upper limbs the subclavian veins, which are near the clavicles, the axillary veins, which are near the underarms, the cephalic veins, which is essentially in the region that's next to the humerus. It has a really interesting name because, as I mentioned earlier, the term cephalic means head, but this is a vein that's not anywhere near the head. It's in the arm, that is, it's situated between the shoulder and the elbow joint. So this is a major vein that parallels the humerus in the upper limb. We have the basilic veins, which are nearby to the cephalic veins, the radial and ulnar veins, which are found in the forearm, as well as the digital veins, which are found in the fingers that drain blood from the fingers and return it back to the heart. There's a really interesting vein that's located in the in the thoracic region, which is called the azygos vein. And this term azygos means that it's not paired. So you'll notice that most of the veins and even most of the arteries that we listed have a right and a left component because our bodies are symmetrical down our midline. And so it makes sense that we have veins that are on the left side are mirrored on the right side. But not all veins or arteries follow that mirroring, and one of those veins, or one of those blood vessels, I should say, is called the azygos vein, which is specifically only found in the right side of the thoracic region, and its job is to drain blood from the right side of the thorax back into the inferior vena cava. The inferior vena cava is similar to the superior vena cava, except it's receiving blood from the lower parts of the body. So it's draining blood and receiving blood from the hepatic, the renal, the gonadal, and the common iliac veins, and it's going to return that blood to the right atrium of the heart. So next we have the renal veins, which again the term renal implies kidneys. So these are the veins that are draining that filtered and cleansed blood from the kidneys, returning it back to the inferior vena cava. Got the gonadal veins, which, as their name implies, gonads, and gonads are specifically referring to the ovaries and the testes. So these are veins that are draining some of the reproductive system structures. Moving down into the abdomen, we have the superior mesenteric vein, which is a vein that is receiving blood from the small intestine, the stomach, and some of the parts of the large intestine. Similarly, we have the inferior mesenteric vein, which is a little bit lower in the abdomen. So the term superior and inferior in these veins kind of highlights their location in the abdomen. And the inferior mesenteric vein is going to drain blood from mostly a small part of the large intestine, mostly the distal parts of the large intestine. So that's kind of further away from the beginning of the large intestine. The gastric vein, as the term gastric implies, is draining blood from the stomach. And all of these veins, the superior mesenteric, the inferior mesenteric, the gastric veins, and even the splenic vein, which I don't think I've mentioned here yet, they have this interesting configuration in that all of these veins that drain the structures of the digestive system all wind up draining into this common vein that's called the hepatic portal vein. And the hepatic portal vein receives blood from the superior mesenteric, the inferior mesenteric, the splenic, and the gastric veins. And it takes the blood from all of these veins and it drains it into the liver. And the reason for this is that the liver is a structure that is designed to cleanse any potentially harmful or toxic substances that we may have ingested or absorbed through the digestive system. And so the hepatic portal vein collects all of the blood that's draining from these structures and funnels it into the liver so that the liver can process and cleanse that blood. And after that blood has been cleansed and processed by the liver, it leaves the liver through a vein called the hepatic vein. And it's the hepatic vein that's going to drain that blood from the liver back to the inferior vena cava. And so this makes sure that the blood that's leaving the digestive systems that may have potentially toxic or potentially harmful substances in it that we've ingested by consuming them is going to be cleansed before that blood gets back to the heart. Because as we've seen, the heart is a structure that is fairly sensitive to blood chemistry, and so it's important that the blood that's going back to the heart has been cleansed by the liver. Moving down into the lower limbs, we have the common iliac veins, which are receiving blood from both the internal and external iliac veins. Internal iliac veins, as their name implies, are receiving blood mostly from inside of the pelvis, and so it drains blood from some of the smaller blood vessels that are in the pelvic cavity, as well as the gluteal muscles. The external iliac veins are mostly receiving blood that's being drained from the lower limbs back up to the heart. So we've got the femoral vein, which parallels the femur in the thigh. The great saphenous vein, which is actually the longest vein in the human body. It goes pretty much from the hip joint all the way down to the feet, and it also serves to drain blood from the lower limb back up towards the heart. The popliteal veins, which are veins that are found behind the knee. Anterior and posterior tibial veins, as their name implies, anterior tibial vein found anterior to the tibia, posterior tibial vein found on the posterior side of the tibia, and then finally with the digital veins, which are found in the toes, and they are draining blood from the toes back up towards the heart. So that does it for kind of the major, all of the major veins and arteries that I would have you identify on the diagrams. And as I mentioned, there's plenty of practice questions on identifying those in the lab report, as well as the blank diagrams that are on Moodle. The last item on the lab list here are a few calculations questions that I wanted to just kind of summarize here. What I'm looking for you to be able to do is calculate two items. The first is called cardiac output, and the second is called mean arterial pressure. There's plenty of practice questions on these in Moodle, and if you have any questions on these or need any follow-up, let me know by email, and I can certainly put a few more practice questions on Moodle for you to, or introduce you to a few more practice questions so you can get to play with some of these numbers a little bit better. The more practice you have, I think the easier it gets in these calculations questions. So here's the two calculations. We'll start with cardiac output. Cardiac output is a variable that has units of milliliters per minute. So the cardiac output is really measuring how many milliliters of blood per minute is the heart moving, right? And it's calculated very simply by taking heart rate, which is in beats per minute, and multiplying that heart rate by stroke volume. And stroke volume is the amount of blood that the ventricles are moving with each beat. And so if you look at the units of each of these, heart rate is in beats per minute, stroke volume is in milliliters per beat, because stroke volume is measuring how much blood the heart is moving with each beat. Notice that in heart rate, beats is in the numerator, while in stroke volume, beats is in the denominator. And so when we have two units that are in the numerator and the denominator in a multiplication problem, they cancel out. And so what that means that we're left with is milliliters in the numerator and minutes in the denominator, which is exactly what our units are for cardiac output. So anytime you're calculating cardiac output questions, keep in mind that the units are going to be milliliters per minute because we're measuring how many milliliters of blood are being pumped by the heart each minute. And it's a simple multiplication problem. You take heart rate and multiply it by stroke volume, and that gives you cardiac output in milliliters per minute. The second calculations question that we have is called the mean arterial pressure, which is in our units of pressure, which are called millimeters of mercury. And the reason why we have this kind of strange unit for pressure is that the way that we used to measure pressure was by determining how high that pressure would cause a column of mercury to rise. And mercury is a liquid metal, that is, it's liquid at room temperature. And if you have it in a glass tube or a glass column, the mercury will rise or fall depending on the pressure, the air pressure that's around it. And our measurement of millimeters per mercury simply was derived from how high, in terms of number of millimeters, did the column of mercury rise under that pressure. So that's why we have the units of millimeters of mercury, which is abbreviated mmHg for mean arterial pressure. So anytime we're dealing with a pressure, we're going to be dealing with millimeters of mercury as our units. And the calculation for mean arterial pressure is that you take the systolic blood pressure, which is the blood pressure of the heart when the heart is in systole, that is when the heart is in its period of contraction, because that's when blood pressure is going to be highest. You subtract that from the diastolic pressure, which is the blood pressure experienced by the heart and the blood vessels when the heart is relaxing. So we take the systolic pressure, subtract the diastolic pressure, and then we divide that by 3. And then after we divide that by 3, we add whatever number that is back to the diastolic pressure. And so a really quick check, a really good way to kind of quick check whether or not you calculated mean arterial pressure right is that your calculation for mean arterial pressure should be higher than the diastolic, right? Because you're taking the diastolic and you're adding something to it. So automatically that should tell you that your mean arterial pressure should be a little bit higher than the diastolic pressure number that you're getting, but it should be lower than the systolic pressure. So you should see that mean arterial pressure is somewhere between systolic and diastolic pressures if you do the calculation correctly. So I'm happy to provide more examples by email or by practice questions in Moodle. So feel free to reach out to me and just let me know what you need. I'd be happy to accommodate. So I hope that helps in your studies with this module. As always, feel free to reach out to me with any questions, or I'm happy to schedule a virtual meeting with you if you need it. So hope that helps. So take care, and I hope to see you all in the next one.